Hello everyone. Today I'm going to be talking about alcohol dependence and treatment among young adults. Imagine a typical weekend on a college campus. Laughter echoes across the quad, music spills out from dorm rooms, and nearly every social gathering involves alcohol. For many young adults, drinking seems like just a part of life, a way to relax, bond, or celebrate. But beneath the laughter and cheers, a silent crisis is unfolding. Some students are drinking not just for fun, but because their brains and bodies are being shaped in ways that make stopping difficult. The consequences, academic, social, emotional, and even physical, can be devastating and life-threatening. Yet, most people never even see the full picture, not even you. Alcohol dependence doesn't announce itself with a warning sign. It sneaks in gradually, altering behavior, health, and relationships. Today, we're going to uncover what alcohol dependence really looks like for young adults, why it happens, how it affects people differently, and, most importantly, what evidence-based treatments are available to help them reclaim their lives. Now that we've set the stage, let's look at the numbers behind this issue. Alcohol use disorder is one of the most common mental health conditions affecting young adults in the United States. National studies estimate that roughly 14% of adults meet the criteria for alcohol dependence within a 12-month period. Among college-aged individuals, that number climbs to nearly 18%, meaning almost 1 in 5 students may meet the criteria for an alcohol use disorder in any given year. These numbers are staggering, but they only tell part of the story. In Pennsylvania, for example, surveys show that young adults report significantly higher rates of binge drinking than older age groups, highlighting that not only a national concern is present, but also a very real local problem is as well. Binge drinking is defined as consuming 5 or more drinks in a single occasion for men or 4 or more drinks for women, and it is linked to accidents, injuries, academic problems, and increased risk of developing dependence later in life. It is important to note that alcohol dependence is not evenly distributed across the population. Gender differences are clear. Men generally report higher rates of alcohol use disorder than women, yet women often experience more co-occurring mental health issues, such as anxiety or depression, which can complicate treatment. Age differences also matter. Young adults, particularly those aged 18 to 24, show the highest prevalence of heavy drinking and alcohol-related problems, reflecting a developmental period where social pressures, brain maturation, and risk-taking behaviors intersect. Ethnic and cultural factors influence both alcohol use patterns and access to treatment. Studies show that rates of drinking, binge drinking, and alcohol use disorder can vary across racial and ethnic groups due to cultural norms, social environments, and disparities in healthcare access. This means prevention and treatment strategies need to be culturally sensitive and tailored to the populations they serve. Beyond just prevalence, the social and economic impact of alcohol dependence is substantial. Heavy drinking among young adults contributes to missed classes, poor academic performance, workplace absenteeism, strained relationships, legal issues, and healthcare costs that all burden both families and society. Understanding the scope of the problem is crucial, not just for clinicians and researchers, but for educators, policymakers, and peers who interact with young adults every day. These epidemiological insights set the foundation for why we need effective interventions, targeted education, and ongoing research to address alcohol dependence in this vulnerable population. Etiologically, alcohol dependence does not stem from one single cause. Rather, It reflects a combination of biological, psychological, and social influences that interact in complex ways. Biologically, individuals with a family history of alcohol problems are more genetically vulnerable, and research shows that the brain's reward pathways can make alcohol particularly reinforcing for some people. Psychologically, stress, anxiety, and depression can push young adults toward alcohol as a coping mechanism, especially during emotionally intense periods like college. Socially, environments where heavy drinking is normalized, such as fraternities, sporting events, or weekend parties, significantly elevate risk. Understanding these interconnected influences helps explain why alcohol dependence develops and, importantly, why effective treatment must address multiple domains at once. Gender, age, and cultural differences further shape risk and treatment outcomes. Men consistently show higher prevalence rates of alcohol use disorder than women. However, women are more likely to experience co-occurring mental health issues such as anxiety or depression and often face greater stigma when seeking treatment. Young adults aged 18 to 24 remain the highest risk age group for binge drinking and alcohol related harm. Cultural and ethnic backgrounds also influence patterns of use, attitudes about drinking, and access to care. For example, racial and ethnic minority groups often face barriers to treatment stemming from cultural stigma, lack of culturally informed services, and historical distrust of healthcare systems. Recognizing these demographics influences is essential for tailoring treatment and prevention efforts. There are many myths about alcohol dependence that paint an inaccurate picture of the disorder. A common myth is that most people with alcohol use disorder eventually seek professional help, when, in reality, only about 7 to 10% do so each year. Another misconception is that alcohol problems primarily affect older adults, when in fact, young adults show some of the highest binge drinking rates of any group, as mentioned before. And while peer pressure is often blamed as the sole cause, scientific evidence shows that genetics, mental health, trauma history, and environmental influences all play powerful roles in the development of alcohol dependence. These myths illustrate how easily society oversimplifies a very complex disorder. Let's introduce a hypothetical case in order to help bring these ideas to life. How about a 20-year-old student named Alex? Alex binge drinks most weekends, often to the point of blacking out. Grades are slipping, conflicts with roommates are increasing, and stress has become a daily experience. Although Alex repeatedly promises himself to cut back, the drinking yet continues. Over time, Alex develops tolerance, experiences withdrawal symptoms like irritability and headaches, and loses control over how much and how often he drinks. According to DSM-5-TR criteria, Alex meets multiple indicators of alcohol use disorder. What makes this example powerful is that it mirrors the lived experiences of many, many young adults who struggle silently with alcohol dependence while trying to navigate school, relationships, and identity, despite being a young adult. All of these dangers sort of beg the question then, well, what is the best evidence-based treatment for alcohol use disorder? The best evidence-based treatment that we have for alcohol dependence is most effective when it addresses behavior, biology, and social support all simultaneously. Behavioral interventions such as cognitive behavioral therapy and motivational interviewing help individuals recognize triggers, challenge distorted beliefs, and build healthier coping strategies. These therapies have strong empirical support for reducing harmful drinking patterns. Medication-assisted treatments, including naltrexone, acamprosate, and disulfiram, can reduce cravings, support abstinence, and decrease alcohol's reinforcing effects. However, despite substantial evidence supporting their effectiveness, these medications remain underused among young adults. Peer-supported programs like Alcoholics Anonymous also play a crucial role. A Cochrane report found that Alcoholics Anonymous participation significantly improves long-term abstinence and recovery outcomes. Research increasingly shows that the best outcomes occur when therapy, medication, and peer support are used together and tailored to the individual's age, cultural background, and mental health needs. The cost and length of treatment vary widely depending on the type of care. Outpatient therapy may last several weeks to several months and typically ranges from $50 to $200 per session. Inpatient rehabilitation usually lasts between 28 and 90 days, but it can cost tens of thousands of dollars per month. Peer-supported programs like Alcohol Anonymous are free or donation-based. Insurance can significantly reduce costs, but challenges such as prior authorization, session limits, and long wait lists can make consistent treatment difficult for many young adults. These barriers often determine whether treatment is accessible or beyond reach. Here I have a video clip of a young man named Chris who shares his story of his own unique experience with alcohol dependency in college. I want you to focus on the struggles that he has been through and try to piece together what enabled him to get to the situation that he eventually found himself in. Additionally, focus on the greater implications of potential outcomes that alcohol dependency presents itself in young adulthood.
All my friends and I received fake IDs our senior year of high school.
We first started noticing maybe late high school that there was a change with him.
When we got to college, the drinking only increased. My grades started slipping throughout college, and relationships started getting damaged.
When he went to his first year of college, that we saw an even bigger change.
I'd been drinking really excessively during my freshman year of college and struggling with my grades, and decided a fresh start would be beneficial to me. I transferred colleges after my freshman year of college.
And we couldn't figure out what exactly was going on, depression, anxiety.
Yes, we knew he drank, but so did everybody else.
Continued to drink fairly heavily when I came to Miami. Started seeing a therapist because I was dealing with a lot of depression and anxiety.
I don't think we suspected substance abuse.
I initially thought that I was drinking because I had the depression and the anxiety. I later discovered that I was actually had the depression and anxiety because I was drinking.
Like Kent said, I don't think we fully understood the extent of his substance abuse at that point.
I came to the Haven about 8 months ago after an incident with drinking and left me in the hospital.
He's been through hell.
There were 2 incidents actually where I ended up in the hospital.
It's easy to blame yourself, and we spent a lot of time talking to each other saying, this isn't on us.
I called my therapist one night after I'd been drinking for a while, and I asked her if the antidepressants that she had placed me on would kill me if I took the whole bottle of them. And she told me no, and I told her that's not the answer I wanted to hear, and I hung up on her. Continued to drink, eventually called the National Suicide Hotline. 20 minutes later, I had 2 officers knocking on my apartment door. I told them I'd never been cuffed before, so I'd like to go unwillingly. So they cuffed me and put me in the back of a police car and drove me to a hospital up here at Miami. And the doctors there had actually suggested that I come to the Haven as a program for recovery.
What the Haven offered him is it offered him a place to come and sort of say, I have a problem, I know you're not going to judge me. And the Haven was this safe, secure environment that allowed him to sort of work through it.
The change was really astonishing to me. Depression disappeared, anxiety disappeared, started doing better academically, my relationships improved, particularly with my parents.
They happen to have this brand new program, and I think Chris will probably tell you that it saved his life.
It saved his life. He has told us the Haven saved his life.
Yeah.
Yeah.
It works when you reach out for help.
Students can now address drug and alcohol issues on college campuses 3 effective ways at the Haven: mentoring and monitoring program, outpatient centers, and recovery residences. Get back on a college track immediately at premier universities across the U.S. Call or text today.
Now, after watching, it is clear that Chris fit the criteria of alcohol dependence disorder at such a young age. Campus life, peer pressure, and the persistent abuse of alcohol negatively impacted his life in a multifaceted way, as his environment essentially enabled and cultivated the perfect storm to ruin his life. His relationships were harmed, his physical well-being and mental health were all shattered due to alcohol dependency. However, I think the most important element to take away from Chris's story was that he falsely assumed he was abusing alcohol because he was depressed. However, this couldn't be further from the truth, as it was the abuse of alcohol itself that led to his depression and eventual suicidality. Chris's story paints the full picture and painful reality of many young adults, the majority of whom suffer from this issue. Think about Chris's story, and remember that this issue is more prevalent than you may realize due to these common misconceptions. In Pennsylvania, practitioners treating alcohol dependence must hold the appropriate professional credentials. These include licensed professional counselors, licensed clinical social workers, and licensed psychologists. Many also obtain additional certification in addiction treatment, such as the Certified Advanced Alcohol and Drug Counselor credential issued by the Pennsylvania Certification Board. These credentials ensure treatment is ethical, evidence-based, and delivered by professionals trained specifically in substance use disorders. Cultural differences across countries also shape how alcohol dependence is viewed and treated. Some European countries have strict regulations on alcohol sales, while others integrate alcohol into daily life in low-risk ways. Certain Asian cultures may attach significant stigma to substance use, reducing the likelihood of help seeking. Indigenous communities often emphasize holistic, community-centered healing practices. These international differences remind us that alcohol dependence is both a global and culturally specific issue, and effective treatment requires cultural sensitivity. Public service messages about alcohol use vary widely in quality and impact. Many rely on fear-based tactics, such as graphic imagery or dramatic warnings. However, research shows these strategies rarely produce lasting behavior change in young adults. More effective campaigns, however, feature real stories, relatable experiences, and clear treatment pathways. The best prevention messages are honest, emotionally engaging, and designed with the target audience in mind. Ethical issues frequently arise in alcohol dependence treatment. Clinicians must balance confidentiality with safety concerns, such as impaired driving or potential harm to self or others. Issues of autonomy are also important, especially when young adults feel pressured by parents, partners, or courts to enter treatment. Concerns about equity and access also emerge, as marginalized communities often face limited treatment resources. Ensuring informed consent, avoiding stigmatizing language, and providing non-discriminatory care are essential components of ethical treatment. Insurance and payment pose additional challenges of their own. Plans may restrict the number of therapy sessions covered, require prior authorization for medications, or impose high co-payments that discourage ongoing treatment. Young adults on parental insurance plans may fear their parents seeing explanation of benefit statements, adding another barrier to accessing care. Without adequate insurance, many individuals are forced to rely on emergency services or inconsistent treatment, which undermines long-term recovery. Fortunately, there are strong local and national resources available to support young adults seeking help. In Pennsylvania, resources include the Get Help Now hotline, university counseling centers, local Alcoholics Anonymous chapters, and community-based treatment programs such as Guidenzia and Livengren. National resources include the SAM HSA helpline, the NIAAA Alcohol Treatment Navigator, and the Shatterproof Treatment Atlas. All of these organizations provide information, crisis support, treatment directories, and peer support connections. There are legal issues that are also relevant in alcohol dependence cases. DUI laws, underage drinking statutes, and campus sanctions can all intersect with treatment. Good Samaritan laws protect young adults who seek emergency medical help for someone experiencing alcohol poisoning, which encourages safer behavior. Clinicians must also adhere to mandatory reporting laws when a client presents a danger to themselves or others. Fortunately, there are many promising areas for future research. Digital interventions, such as mobile apps and telehealth therapy, may greatly improve accessibility for young adults to get better help. Gender-specific treatment programs for young women, trauma-informed care approaches, culturally adapted interventions, and biological markers that may predict treatment success all represent important avenues for ongoing study. Continued research can lead to more personalized and effective treatment models. Now, what would I do if the NIH hired me as a policy consultant? Well, I would recommend increasing federal funding for early intervention programs on college campuses, expanding insurance parity for substance use treatment, reducing barriers to medication-assisted treatment, and supporting nationwide implementation of screening, brief intervention, and referral to treatment, or SBIRT. I would also advocate for culturally tailored prevention campaigns that resonate with young adults from diverse backgrounds. These policies all could significantly reduce alcohol-related harm and improve long-term outcomes. As we wrap up, it's clear that alcohol dependence in young adults is more than just a statistic. It's a complex interplay of biology, psychology, social pressures, and culture. We've explored how common it is, why it develops, and how it affects different groups of people in different ways. We've also seen that evidence-based treatment exists, from cognitive behavioral therapy and motivational interviewing to pharmacological options and peer support programs, and that recovery is possible when individuals receive the right care. What makes this topic so compelling is how it touches all aspects of young adult life: academics, relationships, health, and future opportunities. Understanding the patterns, myths, and real-world consequences of alcohol dependence allows us to be more empathetic, informed, and proactive, whether as friends, educators, policymakers, or healthcare providers. But the work doesn't stop here. Ongoing research, culturally sensitive interventions, and informed public policy are all essential to prevent alcohol dependence and improve outcomes for those struggling. We can also make a difference on a personal level, supporting peers, sharing accurate information, and encouraging healthy coping strategies. In short, alcohol dependence is a challenge, but it's also an opportunity to apply what science teaches us, to change behaviors and systems, and to help young adults build healthier, more fulfilling lives. Thank you for taking the time to understand this important issue, and I hope this presentation inspires you to think critically, act responsibly, and support those affected by alcohol use disorder in your communities.